And speaking of vision problems, this year alone, an estimated 1.5 million people will have some form of laser vision surgery to correct nearsightedness, farsightedness, or astigmatism. Potential laser surgery candidates have several options, but how do you know what is best for you? Dr. Brent Reed with Griffin and Reed Eyecare is joining us this afternoon to talk about what is available for eye surgery candidates these days. And doctor, what's the first thing a person should consider about surgery? Everybody seems to be doing it now.
It's interesting that it does seem that way, but less than 2% of the population of the United States has actually had the surgery done, Walt. It's fascinating that it's catching on, but it still seems to be new enough that people are concerned, and they should be. I think the number one thing that someone should consider as they consider having laser vision correction done is their safety. And safety is dependent on a number of physical parameters having to do with measurements that are done with the eye, as well as somewhat their expectations of what laser vision correction can deliver, because it's not for everyone.
Mm-hmm. The first thing you see a lot is a lot of ads in newspapers. I think originally when FDA approval came out with Visex, it was $2,000 per eye. Now you frequently see ads for, we'll do 2 eyes for $499.99.
Yeah.
Should that be a red light?
Well, in my opinion, it should be, because the old adage of you get what you pay for is very true. There have already been 2 large center companies come to the greater Sacramento area who have gone into bankruptcy and left a lot of patients high and dry, both for follow-up care, and also they took money from patients who they never did surgery on. And their philosophy was, do as many people as you can in as short a period of time as you can, and try to run it like a Ford assembly line. Unfortunately, that doesn't work well for laser vision correction. So people do need to be aware of the fact that there are significant differences, and cost is, if you're paying much less than $1,500 or so at a minimum per eye, you need to be very cautious, I think.
It's amazing now with laser, instead of the old days when people were going and having what with a refractive, when it was actually, the eye was actually cut. The laser itself is only on the eye for less than 5 seconds per eye?
Well, it's a little longer than that. It just depends upon how much correction needs to be done. I think the longest correction I've ever seen done is in a far-sighted patient. They generally take about twice as long for the same amount of correction, about 1.5 minutes.
Okay.
Typically, the laser actually is on the eye and doing its work for less than 1 minute. And the devices now have a tracker, most of them do, especially the Visex machines, which is what we prefer, and it does a wonderful job, follows the eye. It's like you have a radar lock, basically.
What's the risk in this? The laser makes it a lot easier, safer, quicker, and all of that. What's the risk still there? The
risk is that you're going to have or go to someone or do this in a place where the equipment may not be adequate or properly maintained, or that you may not get the kind of vision that you expect out of the laser vision correction. Because I would caution people to especially be aware of the fact that any doctor who promises them an outcome is not telling the truth. No one can promise outcomes, only God can. And unfortunately, doctors aren't gods, although some think they are.
Interesting point. You had the laser surgery done. What were some things? I mean, obviously, if you did it, you completely checked it out.
Absolutely. It took 5 or 6 years of very careful investigation. I would advise people to gain as much information and knowledge as they can from reliable sources, particularly internet sites that have no bias, like the one set up by the American Academy of Ophthalmology, or the American Society of Cataract and Refractive Surgery. That's ASCRS for short. Those sites are unbiased. They're able to give information. Also, attend seminars, learn about the procedure itself. My priority list was very specific. Well, number 1, it had to be safe.
Right.
Number 2, it had to be predictable enough to make me happy. And number 3, I had to find somebody I could trust to treat me like family.
There you go. That's important points. Doctor, thank you. We'll be chatting about. Thank you.
Thank you all.